Hi, everybody. So I'm trying out a new recording device. A lot of people were complaining about the feedback from the other microphone. So I hope this one will be a little bit better. And if it's not, please let me know. So we're going to finish off with toxinology. We've covered snakes and we've covered scorpions. We are going to cover spiders today. Now, toxinology doesn't end there. It depends on where in the world you are. Toxinology can extend to plants, marine life. There's so much that it can extend to. I was actually reading a book recently on um, the poisonous wildlife on Borneo, which just shows you how I spend my Saturday nights now that my Netflix has expired. I can't use my brother's password. Yeah, so it's just amazing to see, just because it's such a lush tropical area, and the amount of dangerous wildlife that they get over there, from frogs to insects to plants and things like that. So I've really looked at this from a South African centric point of view, and really looked at the three most common that we get here, which is snakes, spiders, and scorpions. But really it depends on where in the world you are. So it's not going to be a very long one. Hopefully, it's just a few slides just to finish off everything. And yeah, so we're just going to talk about spiders. So spiders generally, we tend to get the cytotoxic ones, which are sac, violin, and recluse spiders, although there are others as well. So how do the cytotoxic ones look? Generally, those that do cause cytotoxicity, and if you remember our previous one, cytotoxicity essentially means breakdown of tissue, so it can range from, very mild cytotoxicity to quite severe as well. But most of the time, it's a painless bite. It frequently occurs at night. So most patients will often come the next day or within a day or two and report this area, which has these, quite significant, or let's say quite pathognomic presentation. So you may find fang marks and bleeding, but I must be honest, it's not actually that common. And especially in the South African context, with some of the spiders that we have, the most common being the common the brown house spider. Because of its size, you can't actually make out the fang marks, but in some of the larger spiders, you can. Pruritus is a very common finding, although it's superseded by the cytotoxicity. So generally, there's more skin changes than there are pruritus on its own. So this is what happens in the first 12 to 24 hours in the bite area. So erythema, edema, pain, and then mottled hemorrhagic areas and blistering. So most of the time it will just take on the appearance of a furuncle or carbuncle. It often needs just mild, basically conservative management. Dressings, if it's an open wound. If it's not an open wound, antihistamines, antibiotics if there's signs of infection, but very rarely unless it's progressed, and depending on the type of spider as well. So let's say for a common house spider, which is there's different types all over the world, but for most of them, it's just a mild reaction. The patient responds well to some, steroids, analgesia, antihistamines, depending on what they're presenting with exactly. However, some of the more dangerous cytotoxic spiders, which you do get, it's not to say you don't get them, you do get them. The most common presentations thereafter, you get cellulitis, which can be widespread. But it's very different to the types of cellulitis that you would see with snake bites and scorpion stings. For example, there's no skip lesions, there's no loss of tissue. It tends to follow a very normal course of cellulitis that you would see in, just general cases of cellulitis. It generally just follows that pattern. It's not a special type of cellulitis that's associated with spider bites, the cytotoxic spider bites. But the one that we always worry about is if it does go to necrotizing fasciitis. Now, necrotizing fasciitis generally, or not generally, it is an anaerobic infection. And it tends to spread along the tissue planes, just in the fascia, so below the muscle. This is what makes it difficult, because sometimes there's associated cellulitis and sometimes there isn't. and it can be very difficult to distinguish it. Or let's say not, or let's say to pick it up. Sorry, not to distinguish it, but to pick it up. And the main thing with necrotizing fasciitis is the rate of spread. Because it's spreading along that fascial plane, because it doesn't need oxygen, it just spreads at an incredible rate. So the patient within literally a few hours may present with a slight swell that is, let's say, for example, an ankle bite. Let's just take that as an example. And the next thing you know, it's gone up within half an hour to an hour, it's gone up to mid calf. Within another little while, it's gone up to the knee. And the patient is becoming more and more septic and more toxic. So you start seeing signs of sepsis, tachycardia, pyrexia, hypotension, increased septic markers, things like that. And if you don't keep an eye on it, these patients actually can suffer severe long-term effects, even if you manage to get the infection. In terms of scarring, loss of tissue, it's quite horrifying, actually. It's just an anecdote from my early days when I first started off, when I was a much younger doctor and trying to become a surgeon, which thank God I didn't. But not because I hate surgery. I just looking at my condition in my back, I'd be a retired fool by now. But when I was trying to get into surgery, we had this, it always sticks out in my mind because it was a set of twin girls, both 5, beautiful young girls, absolutely gorgeous. They were just, you could put them on the cover of like advertisements and things like that. And the one girl did get bitten, and by the time she came in, it was a bit late, and we had to now debride a large area of tissue, and it was most of her leg, I'd say from about mid thigh down to her ankle. And she was going to be left with those scars for the rest of her life. Now, the way that it's done differs from surgeon to surgeon, but the main thing is to introduce oxygen into the area. Once you get oxygen into that fascial plane, you generally the organisms can't thrive in that environment. That tends to stop the spread. And of course, we've got to remove all of the necrotic tissue and fascia and things like that. But it always just struck me because I always thought of this young girl growing up. And you can even see, when you look at certain children, you can just see, that when they grow up, they're just going to, they just, how do I explain? They're just going to, she's going to grow up looking at her sister, and young girls, would probably compare, just young boys as well, and she's always going to have this reminder of something that went wrong, and it was just something that always stuck with me throughout my career. And it's not that anybody did anything wrong; it's just, it's just the unfairness of life sometimes, I suppose, is what I'm trying to say. So anyway, that's besides the point. Okay. So yeah, most wounds will heal spontaneously. You don't have to do much. In fact, a lot of patients don't even present. So if you do get a secondary infection, you treat with a broad spectrum antibiotic as per protocol in your hospital. Generally in South Africa, we treat with Augmentin or something along those lines. You can also use flucloxacillin, anything that would, any of the penicillins, depending on patient's allergy status and things like that, And like I say, more serious wounds or those with significant spread are generally treated by the surgeons. The reason being debridement. Debridement is very often needed. Patients often need high-dose steroids, high-dose antihistamines, lots of analgesia. It's not a pleasant thing for them to go through. So it brings the question, when do I get worried? So the times you get worried are when you see cellulitis or when you see a limb that's progressively getting worse within a short period of time. Okay, my apologies for any background noise. Yeah, anyway. So these are your different types of spiders. So this is your sex spider, commonly associated with the large, what do they call that organ now? It's just slipped out of my mind. Oh, it's just completely slipped out of my mind. If anybody remembers, please tell me. I had it written down and I completely forgot. The violin and the recluse spiders are also quite close to one another in terms of appearance, but the sac spider quite different because of that large abdominal organ there at the back. It's got a specific name. I just can't remember it. So that's the end of that. Now, there was one other spider that I wanted to cover, and this was the black widow spider. It's just that I don't have it on this, so I'm just going to skip over to that, and then we're going to just talk about that. Okay, so yeah, so I just wanted to talk about the black widow spider. Just I'd forgotten to put it on the slides, unfortunately. So this is what the black widow spider actually looks like. Quite typical red markings there on that abdomen. So it's quite easy to identify. Now in South Africa, they're normally found in the Western Cape, especially in agriculture. Very common in the vineyards. So anybody coming from area wine growing area, it's quite common. But any sort of agriculture, that's where it's most commonly seen. And because of the small size of the spider, and it's something that people do know about and people do watch out for it. But nevertheless, unfortunately, these they do have sets of bites coming in every year. But where the spiders are, the spiders are endemic. They're normally quite well prepared to handle them. So what happens? So you normally have sharp pain, swelling, redness, and the fang marks are actually quite easy to spot. Now, this is the thing. The severe symptoms appear quite quickly. So muscle cramps and spasms that start near the bite and then spread and increase. And they can be quite severe spasms. In fact, sometimes mimicking tonic-clonic, and you can even have proper tonic-clonic seizures as well. Chills, fear, nausea, or vomiting, sweating. Now, they've put here severe belly, back, or chest pain. And I just want to talk about the abdominal pain that you get with the black widow spider bite specifically. They have an absolutely rigid abdomen that mimics peritonitis, but without rebound tenderness. So this is something for anybody to remember, especially those of you who are going to work in the Western Cape, something you can pull out on the rounds. They're quite impressed if you know this. So rigidity of the abdomen, mimicking peritonitis, but without rebound tenderness. That's the easiest way to actually differentiate it. And the sweating is quite severe. It's basically full on diaphoresis. So that's the other way to get it. Headache, stupor, restlessness of shock. And the last one is the severe high blood pressure. The BPs just shoot up to ridiculous levels. And this is how you know that something's going on. Now, of course, at the site, there's quite a few things that can be done. It's generally diagnosed through physical examination. But the main thing after that is there is no antivenom as far as I know, but this is what they've got to use. So we use benzodiazepines and opioids and things like that. Calcium has been used, and calcium infusions are quite helpful, especially for the muscle cramps. And we've spoken about it before with the scorpion stings as well. So it does make a difference. And then your antihypertensive meds for high blood pressure. A lot of these patients will end up intubated. A lot of these patients will end up in ICU. A lot of these patients will end up being treated by a specialist toxicologist. So, the most important thing in the emergency department is to recognize it. That's the most important thing. But it's one of those things where if you work in an area that it's endemic to, people will come in and tell you, listen, this is a black widow spider bite. They know it. They've seen it. They've often seen the spiders themselves. They will be the first ones to tell you, listen, there is something that's going on over here. Okay. So anyway, I hope you guys enjoyed that. And yeah, this is kind of me with spiders as well. Yeah, hopefully we'll have another topic soon. And yeah, I hope you guys enjoyed that. And my apologies for any background noise that may have been there. Okay, bye.